On News Center Maine at 5 today, we introduced you to Minday Beyer. She has been living with congenital heart disease for more than 4 decades, and her journey came full circle when she was hired by Maine Medical Center to work with cardiology patients who are in recovery.
To get us all thinking more about heart health this month, Beyer quizzed us on a few things that we should all know about heart health, including symptoms.
All right, question 1. How many women in the U.S. are living with some form of heart disease? 1 in 12, 1 in 10, 1 in 8, or 1 in 3?
I mean, you want the number to be low, but I feel like because it's a question, it's not low.
I'm going C, 1 in 8.
Okay, I'll go B, 1 in 10.
And 1 in 3 women are living with some form of heart disease. And remember, that can be anything from being born with heart disease, acquired heart disease, so it could be all different types of heart disease.
Oof, that is scary. That's a scary number.
True or false, heart disease and stroke cause almost as many deaths in women each year as breast cancer.
False.
True.
False. Heart disease and stroke cause 1 in 3 deaths each year, which is more than all the cancers combined.
Yikes.
So signs and symptoms of a heart attack include which of the following for women? Uncomfortable pressure in the chest, discomfort in one or both arms, back, neck, and jaws, or stomach even, shortness of breath, cold sweats, nausea, or lightheadedness, or E, the faithful all of the above.
This is definitely an all of the above.
Oh, absolutely.
Absolutely. Good job, all
There
of
we
the
go.
above.
Some of those I knew. All right, we're on the same page.
So if you are having any of those symptoms, you definitely want to call 911 and get to the ER because you never know if those are real, true heart attack symptoms, and we want to make sure that you are getting the right care timely.
Yeah, that's why. I mean, jaw pain or even nausea, those are things that I wouldn't necessarily
No, I
piece
wouldn't
together
associate
with.
that.
And women definitely have those symptoms that are a little bit odd more than men. So that's part of the reason why we do go red, to make sure that people know that those funny jaw pains or that back pain may be a symptom of a heart attack, and you shouldn't overlook it. All right, true or false, most cardiovascular disease is due to hereditary, and you just have it or you don't?
I'll say true.
You'll say true?
I'll say true.
I would say false. Some people can develop it, right?
False is right. So depending on how you're living your life, so exercise, diet, all of those play a factor. Hereditary is important to know, so you do want to know if it's something that runs into in your family. It is a factor, but you can actually help through some of your lifestyles. True or false, women are more likely than men to have a heart attack symptoms unrelated to chest pain?
Well, based on the last question, I feel like true. What do you
I'm
think?
going with true on that one. It seems like there are a lot of other factors.
That's right, true. So as we kind of talked about, women's symptoms can be things like neck, jaw, stomach, shoulder, shortness of breath, sweating, lightheadedness, just being tired. And so really it comes down to that body whispering versus screaming at you. So listen to those signs and symptoms.
Very important stuff.
I'm just going to assume I won that contest, by the way.
I believe our producer knows.
He took the tally, Amanda.
You did
It's
not.
fine, show off.
But it was fascinating to have that conversation with her because it's like we said, jaw pain, something I would
Never would have thought.
Or like that lower abdominal pain in a woman, like I never would equate that to I might be having a heart attack. But
Yes, and her message of if you're just not sure, call for help and find out.
yeah, or and definitely know your body. Pay
Yes.
attention to your body.
Always. All right, you can learn a lot more about those symptoms and healthy habits by finding that story on our website and our News Center Maine app.
And join us all month long as we dive into some heart-healthy diets and some workout routines to keep all aspects of your mind and body healthy.